Welcome to IMG Doctor Diaries. If you're applying for NHS jobs or UK specialty training, whether you're an international medical graduate or a UK-trained junior doctor, this video is for you. After doing extensive research, scrolling through Reddit threads, speaking to doctors who've recently been interviewed, and based on my own journey, including my very first NHS shift, I've compiled the most common interview questions and how to answer them using SBAR, clinical reasoning, and professional structure. I know how hard it is for IMGs to get that first NHS job. The process is competitive, the system is unfamiliar, and it's easy to feel lost. But with the right preparation, you can stand out. In this video, I'll walk you through key question types, and in future videos, I'll cover even more clinical scenarios like chest pain, PE, stroke, GI bleed, prescribing errors, and more. Let's dive in. Whether you're applying for a clinical fellow post, an SHO-level job, or a training program like IMT, internal medicine training, the structure is usually the same. You'll usually be asked, tell me about yourself, a clinical scenario, e.g. sepsis, chest pain, an ethical or professionalism scenario, some generic or wrap-up questions. Let's go through each part step by step. Interview question. Can you tell me a bit about yourself? Example answer. I'm an international medical graduate currently working in acute medicine, and I've been in the NHS for the past 2 years. I've gained experience across ward-based care, medical take, and high-acuity settings, including elderly care and rapid assessment units. My future aspirations include applying to specialty training, particularly internal medicine training, and sitting the MRCP exams to progress toward becoming a medical registrar. I'm drawn to the NHS because of its structured career development, emphasis on clinical governance, and strong multidisciplinary approach, and I'm excited to continue growing within this system. But remember, don't just use the same format or copy answers. You need to make it personalized to you. They do not want to hear the same thing from 100 different people. The next part of the interview is usually a clinical scenario. This tests your ability to assess an unwell patient, make safe decisions, and escalate at the right time. You'll usually be given a brief opening line. And as you talk through your A to E assessment, the interviewer will feed you additional information like vital signs, blood results, or clinical findings. Here's one of the most common examples and how I would approach it. Describe how you would manage a septic patient on the ward. If I suspected sepsis in a patient, I would follow a structured, urgent approach. A to E assessment. I begin with an A to E assessment to identify and address any life-threatening issues. A. Is the airway patent? If not, I'd call for help early. B. I'd assess respiratory rate, oxygen sats, auscultate the chest, and start high-flow oxygen if required. C. I'd check BP, heart rate, cap refill, and look for signs of poor perfusion. D. Assess GCS, pupil response, and glucose. E. Look for rash, source of infection, temperature, and perform a full exposure check. Based on the findings, I'd calculate the NEWS2 score and identify red flags suggesting sepsis. Initiate the Sepsis 6 bundle. Administer oxygen. Take blood cultures. Start broad-spectrum IV antibiotics. Begin IV fluid resuscitation. Check serum lactate. Monitor urine output possibly via catheter. Escalate. Using SBAR. S. Hi, this is Dr. X on Ward 6. I'm calling about a deteriorating patient. B. This is an 80-year-old male admitted with a UTI. He's now febrile, 39 degrees Celsius, hypotensive, BP 85/60, and confused, GCS 13. A. He meets criteria for septic shock. I've completed the Sepsis 6, but he hasn't responded to fluids. R. Please, could you review urgently? I think he may need HDU or ICU support. I'd continue close monitoring, repeat lactate if needed, reassess fluid response, document thoroughly, and ensure timely senior input. This structured approach, starting with A to E, delivering the Sepsis 6, and escalating clearly, shows that you're clinically safe and ready to work in an NHS environment. Next, you'll usually be given an ethical or professionalism scenario. This part tests your judgment, values, insight, and understanding of GMC good medical practice. You may be asked a "what would you do" question, or be given a scenario that develops as you respond. So stay calm and apply a logical, professional approach. Here's a classic example. How would you deal with a colleague who regularly arrives late to handover? If I noticed a colleague was consistently arriving late to handover, I'd approach it in a respectful and professional way. Number 1. Observe the pattern. First, I'd make sure it's not a one-off incident. Everyone can run late once, but repeated lateness is a concern, especially in clinical settings. Number 2. Private, supportive conversation. I'd speak to the colleague privately and non-judgmentally. I'd ask if everything is okay. They may be facing transport issues, health concerns, or personal problems. My approach would be based on curiosity and support, not confrontation. Number 3. Explain the impact. If appropriate, I gently highlight that missing handover can affect patient safety and team communication. I try to encourage a solution, such as speaking to the rota coordinator or a supervisor for support. Number 4. Escalation if needed. If the issue continued and patient care was being affected, I would escalate to the clinical or educational supervisor, following local policies. I'd ensure confidentiality and professionalism throughout. Number 5. GMC principles. My actions would be guided by the GMC's good medical practice, especially the duties to work effectively in teams, raise concerns where appropriate, and put patient safety first. This answer shows you're fair, compassionate, and willing to act, exactly the kind of professionalism interviewers want to see. The final part of your interview usually includes some generic or wrap-up questions. These might feel informal, but they're just as important because they test your insight, self-awareness, and motivation. Common questions include, why should we hire you? What are your strengths and weaknesses? Where do you see yourself in 5 years? What would you do differently next time? My advice is to prepare a few structured points for each one and link them back to key values: patient safety, teamwork, leadership potential, commitment to training. Use simple, honest language and avoid cliches. Talk about what you've learned, how you've grown, and where you realistically want to go. And most importantly, make sure your answers reflect the values in the GMC's good medical practice, because professionalism and reflection matter just as much as clinical knowledge. If this helped you, don't forget to subscribe to IMG Dr. Diaries for more content on NHS life, interview prep, and IMG survival tips. You might also find these useful. My first shift in the NHS. Why it's so hard to get a job as an IMG. Both of these videos are on my channel, so feel free to check them out. And if you've got questions or want help with your own prep, leave a comment below.